Good afternoon and welcome to our daily COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here each day this week, Monday through Thursday at noon for this update. This is number 48 in our updates. It's coming to you live on Tuesday, May 19th, 2020. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For today's questions, please email us at plymouthinfo@pactv.org, and these forums can be replayed at pactv.org/Plymouth. Today we have an active group of participants. They include Kenneth Tavares and Matt Muratore, and we're joined by Ann Dunn. She is the Director of Assessing. Also by Michelle Bratti, and she is the Director for Elder Affairs in the town of Plymouth. Christopher Smalley, he is the Senior Director of Marketing and Communications at Beth Israel Deaconess. Also Dr. Barry Potvin, and he is a retired Professor Emeritus, Yeshiva University Department of Biology. And Stephen Cole, he's the Executive Director for the Plymouth Regional Economic Development Foundation. And at this time, we're going to go to the Chair of the Plymouth Board of Selectmen, Kenneth Tavares. Welcome, Ken.
Thank you, Steve, and good afternoon to everyone. I just want to remind you that today is election day to fill the seat of Mr. DiMacedo. The polls opened at 7 o'clock this morning, and they're open until 8 o'clock. So all of the precincts are manned and ready to receive you. So don't forget, polls are open until 8 p.m. this evening. Thank you, Steve.
Thank you, and that's Selectman Chair Kenneth Tavares, and I can also report that I did request an absentee ballot some time ago, but for whatever reason, we didn't receive it in time. So I did go to the polls bright and early this morning at a little after 7, and I can tell you that social distancing is being practiced. There's markings keeping us 6 feet apart. There's a shield between the people working the polls and the voters. Brought my own pen, and so for those of you that did not get an absentee ballot in advance, Plymouth is certainly practicing protocols in order to make sure that your voting will be safe today if you're able to get to the polls. And at this time, we're going to move on with our presentation. We date stamp each day, so in the top right-hand corner, you'll see today's date. It's coming to you live on May 19th at noon. And we're doing this to provide you with verified information from not only elected officials, but from experts in the field. We're going to begin with our health portion. We have 2 people participating, and we're going to start with Christopher Smalley from Beth Israel Deaconess. Welcome, Chris.
Hello, Steve, and welcome to all the other panel members. Proud to be on this show with you and them. Just like to say a big thank you to all of the EMS providers in Plymouth and around what we call our service area. As many of you may know, this week is National EMS Week, Emergency Medical Services Week. So a big thank you to Brewster Ambulance, the town of Plymouth ambulance provider, and Chris DeBona for everything that he and his staff do. Locally at our hospital, by the numbers, and I think Matt will probably have some more numbers statewide and regionally. Currently, we have 76 patients that are either positive with COVID-19 or suspected positive. It breaks down to 49 that are actually positive and 27 that are suspected. That's a slightly higher number than what I reported last week. And we are still seeing somewhat of a surge at our hospital here in Plymouth, whereas other hospitals, the surge may have passed a week or 2 ago. It's still an evolving virus, and I'm sure Dr. Potvin will have some more information about that shortly. As much as we're continue to manage COVID-19 at our hospital and in the region, like the state, we're also focusing now on what we call recovery at the hospital. And that's basically a phased approach to how we reopen or recover and bring back elective surgeries, treatments in a very methodical and deliberate way. And what visitors and patients will begin to see is we're a hospital, so we're handling viruses and infectious diseases is something that we do every single day. It's still a very safe environment, but there'll be much more sort of enhancements with social distancing and signage, et cetera, throughout the hospital and inside the hospital when we fully reopen. And there'll also be a very prominent, what we call safe care awareness campaign. That's being rolled out by our system, Beth Israel Lahey Health, and we'll have that here locally. And so what I would ask people in the next couple of days, we should have some information up on our hospital's website, bidplymouth.org, for information. And also, as I've mentioned in the last couple of episodes, if someone's experiencing an emergency situation, they should call 911 and come to the emergency department. It's a safe place to receive care. Again, COVID-19 suspected patients that come to the ER are treated outside. And if they have to come into the ER, they are brought to a separate area to prevent any type of exposure to those that do not have influenza-like symptoms. So that's the update from the hospital as we get ready to fully recover and what we call reopen for business like the Commonwealth of Massachusetts and surrounding towns.
Thank you. And that's Christopher Smalley. He's Director of Marketing and Communications at Beth Israel Deaconess. And certainly his comments about procedures at the hospital are consistent with the information we've also been receiving from both Dr. Ogilvie, the neurosurgeon from Beth Israel, and from Dr. Philip Triffletti, an attending primary care physician. They've encouraged our viewers to continue as Christopher Smalley has. And we're going to continue with our health report today, and we welcome back Dr. Barry Potvin. Welcome, Barry.
Yes, thank you, Steve. Hello, everybody. I'd just like to add something to the Election Day announcement that Ken Tavares made. Please be sure you bring black ink pens. Those apparently work far better when filling out the ballots. Also remember you must bring face coverings or face masks or something with you. You'll be needing them. And you're certainly going to need to bring your patients because you will be waiting outside probably to get into the polling places, at least at some times. Beyond that, in terms of health news, there's positive news. There's so much going on in the last 24 hours, it's hard to even know where to start. But I'll do my best not to get too involved in this because there's other panelists and we need time for questions too. Among the things I've noticed today, if you look at 7-day averages for positive tests, on the 1st of May, it was 16.5%. And then on the 17th of May, it was down to 10.2%. So that's a significant drop. And it seems to be a steady decrease, which is good news. The 3-day average for the number of hospitalized went from 3,707 on the 1st of May down to 2,607 on the 17th. Same good news there. The 3-day average for deaths went from 159 on the 1st of May down to 94 on the 15th of May. So we're seeing lots of consistent drops in a lot of these really critical data points that'll help us as we move forward with reopening. Massachusetts also was reported as among the very best states for stay-at-home numbers as measured by traveling to surrounding states. We're better than almost all the other states that have been looked at. Our rates of traveling to other states was very low apparently in April. It has gone up somewhat in May, especially people going to New Hampshire and Rhode Island, where some of the other restrictions have been lifted earlier than they did in Massachusetts. Another really positive thing is the Moderna vaccine. I talked about vaccines last time. It was developed along with cooperation from NIH. There are 7 other vaccines that are also in testing, but they're kind of behind Moderna. The information they gave out yesterday on a press release was that their stage 1 testing was complete. They had about 48 volunteers of the 8 they reported on. They all had neutralizing antibodies after the vaccine. Of those, only 1 had any kind of side effect, and it was simply some redness at the injection site. That happens with other vaccines too. The other 40 or so, they haven't given out reports on those yet. Their stage 2 test will probably start sometime in June. It will involve about 600 volunteers. And then the stage 3 testing will follow that, and that will involve thousands of volunteers. This is all to make sure the vaccine is both safe and effective. Then they have to go, if all that goes well, they have to go into production. That's going to take quite some time. They're going to be producing obviously huge amounts of vaccine doses. One of their problems is that they need medical glass vials in order to package the vaccine doses up with little rubber stoppers on the top. And apparently, from what I've heard, those are actually coming from other countries. We don't have a big source of those, as far as I know, in this country. I guess Chris might know more about that than I do. There will be some availability, if all is going well, sometime in 2021. We're hopeful it'll be the first half of next year. That is very fast. If you look at what happens with other vaccines over time, in the past, it took around 10 to 15 years for the initial steps in developing vaccines until they actually became available. If you now look at the reopening as more good news, at least for a lot of businesses and for a lot of people who are anxious to especially get back to hair salons and barbershops, I'm sure. The businesses are going to have to self-certify, and they have until the 25th of May to complete some forms and must comply with the new safety standards and best practices. There is a website for that, which is going to come up on the screen later on. But it's basically mass.gov/reopening. I know there's a lot of questions about that. You probably should look at that website before you get too involved in asking a lot of questions, because most of the answers are probably going to be on that website. We also got guidance to municipalities coming in from the state, and there's a number of things there. Obviously, there's going to be some fines that are possible, but that is really the last resort, which will be used only after verbal consultations and redirections and written redirections, and then fines up to $300 if we absolutely have to do it. And I'm sure that that will only be done in cases of really irresponsible behavior that may be endangering other people. Childcare, there was some information on that too. It's not changed. Childcare locations are going to remain the same. The emergency locations are open. They only have about 35% of their capacity in use, so other people may be able to use those same locations as well. Couple of final things. Being outside is definitely somewhat safer than being inside. You're still going to need masks, physical distancing, good hygiene. All those things are critical. Just a few cautionary notes. There's been new surges in cases in some states and in some countries where they've relaxed some of these restrictions, including Alabama, Texas, Dakotas, Tennessee, Kentucky, Iowa, and countries like France, India, China, Moscow, and Iran. There are some new limited studies that were done in the Boston area. Shows that about 9 in 10 people have been unexposed to the virus. So 90% are still vulnerable. If you look in Massachusetts in general, it's suspected about 7 to 10% of the population has been exposed. Probably the 10% is more in the densely populated areas, and the 7% is in less densely populated areas. And there's still about 2.5 to 5% of the people that seem to be asymptomatic, don't have symptoms, including fever. And caution that when you start screening for people with fever, you are definitely going to be missing people who are asymptomatic and could be infectious. So that's, as quickly as I could, the summary of some of the things that have happened in the last 24 hours. Thank you, Steve.
Dr. Barry Potvin, he is a professor emeritus, Yeshiva University, Department of Biology, also the vice chair of the Plymouth Board of Health. And a lot has been happening in the last 24 hours. And we're going to go to Ann Dunn, the Director of Assessing. Welcome, Ann.
Hi, thank you for having me. So today I'm going to speak about clause exemptions. The selectmen have voted through the Chapter 53 of the Acts of 2020 to extend the deadline for filing for fiscal 20 clause exemptions to June 1st. So there's approximately 2 more weeks for people to be able to file. What is a clause exemption? It's a release from the obligation to pay all or a portion of your taxes that have been assessed. The town of Plymouth offers 8 different clause exemptions. There is a lot of information, and it's
So we're going to come back to Ann Dunn. We've lost the connection, but we'll bring her back. We're going to go to Ann. Are you
Yes.
back? Go ahead.
Am I back again?
Yes, you are.
Okay.
The clause
So I'm going to talk
exemptions.
about the clause exemptions. Clause 7.
Oh dear.
Okay, we're going to have the PAC TV studio help Ann with her connection. And at this point,
70. And there is a,
go ahead,
am I
Ann.
gone again?
Go ahead. We're with you.
We're spotty. Yeah, my connection said it could be spotty. I apologize. So this is a $246 exemption. The next exemption is a clause 18, which is a hardship, and it's based on aged, infirmity, and poverty. And the age recommended is 65. All of the exemptions need documentation. It's not just because you've reached the age of 65 or 70 or you are handicapped. They all require certain documentations. We would need all financial information for this, and this is up to the Board of Assessors. So it could be a full exemption. Our next exemption are the veterans exemptions, and there are several different ones. And this is all established through our VA offices, and it is as of July 1st of each fiscal year. So for fiscal 20, you would need a letter from the VA as of July 1st, 2019, showing your percent disability. And the different clauses are clause 22, which is 10% to 99%, and it's a $400 exemption. Clause 22A is a loss of a foot or a hand, and it is a $700.
This is our daily update is coming to you live on May 19th,
Is permanent loss
2020.
or use dollar exemption. I feel like I'm
Go ahead, Ian.
Leaving
We have you.
Clause 22D is surviving spouse or soldier that has died as a result of service-related injury after September 11th of 2001 and 11, and it's 100% exemption for the surviving spouses. 22F is paraplegic or service-related blindness, and that is a full exemption. Again, this is all determined by the VA department. Clause 37A is legally blind. You would need a letter from your doctor stating you were legally blind, and then in the future, you would need a certificate from the Massachusetts blindness, and that is a $500 exemption. Clause 41C is an elderly exemption. It is an age of 65 or older. There is asset and income restrictions. For a single, the income is $20,000. For a married couple, the income is $30,000. The asset level for a single is $40,000. For a married couple, it is $55,000. And it excludes the value of your home. And that is a $1,000 exemption. The other two exemptions that we have are firefighters or policemen, women that have been killed in the line in duty for the surviving spouse, and that would be a full exemption. And there's also one for children of minors of the firefighters or police that have been killed. There is a senior work-off program that is offered through Human Resource, and it's a lottery, and that is to work towards credit off of your tax bill. And you would need to contact them each year to be placed in the lottery. That's what we have, and they are very detailed, and I really request that you go online and look at it, and you're able to download the form. And if you are going to file for this year, please make sure they are mailed by June 1st. We need that postmark. Don't drop it in the slot on June 2nd. It will not be considered. So thank you, and I know it's a lot of information. That's why I recommend that you go to the website or call our office. We'd be happy to discuss each and every one with you and see if we're able to help you. Thank you.
Thank you. That's Ann Dunn, Director of Assessing. For further information, you can also go to the Town of Plymouth website. And Ann, I would just add that when my mother retired, she lived in Kingston, but she did a senior work-off program with the Town of Kingston, and she looked forward to it every year. She loved the opportunity to be involved in a civic manner. We're now going to go to Michelle Bratti. She is the Director of Elder Affairs for the town of Plymouth. Welcome, Michelle.
Hi, Steve. Thank you for having me as always, and hello to all of the panel guests today. Just wanted to remind our seniors in the town, we have at Cal 5 food resources for you of varying degrees. Should you both need food, but also should you want to, there is Nourish Your Neighbor, which is a program that is being offered by the Sunshine Rotary Club, which I think is pretty phenomenal because it combines both a need and a hot meal in Plymouth, along with supporting a local restaurant. The restaurant is paid for this meal. It's funded through a wonderful donor, and it's a win-win. They will deliver a hot meal, and each week a different restaurant is featured. So I just think this is an amazing opportunity to try different restaurants, support your local business, and any of these programs, though, please call us 508-830-4230, and we will help you get what you need. That applies to food and, as always, for any other need that you may have. We are here for you. As mentioned, today is voting for the special Senate election, but I also want to remind you that on June 20th, there is a townwide election. So please look at potentially getting your ballot by mail to vote in that election. Very important in our town. I want to kick off something today that's very exciting, and it's called the Race to 80% or Beyond Census 2020. This is a challenge that is being offered, a challenge Plymouth, between 8 different towns. And the point of this is to fill out your census form. You can do that through online, my2020census.gov. You can call 1-800-923-8282, and the center will have this information, or mail back the questionnaire that you received in the mail. Why is the census so important? Well, it's only done every 10 years. And once you receive the data from that 10 years, those are the numbers we have, regardless of the population surge. Number 2, federal money is distributed to states and municipalities, that's us, Plymouth, based on the census tallies, based on the numbers. And number 3, I didn't even know this, the number of members of Congress in Massachusetts is directly correlated to the census numbers. This is a challenge. The winning town gets the satisfaction and bragging rights of knowing that we as a town made progress towards a complete count. There's, as I said, 8 other towns. Plimpton currently leads this challenge with 75.5% of their census completed. Plymouth is number 6 out of 8 on the list, with only 63.3% of our census completed. So I challenge you, Plymouth. We want bragging rights. We are the best town, after all. So please call us at Cal if you need help executing that, but get that census completed. We want to see our numbers. This is the only time we want to see our numbers go up right now, which is in census tally. That's what I have for today, Steve. Thank you so much.
Thank you, Michelle Bratti, Director of Elder Affairs for the town of Plymouth. And I can tell our viewers that Michelle is available to you if you have a concern about an elder and you want some type of assistance from the town. Michelle is available. I actually had reason to contact her recently regarding a senior, and Michelle responded immediately. And so, again, for all of you watching, she's definitely a referral partner for all of us as we seek to be aware of how to respond to COVID-19 for the seniors in Plymouth. And at this time, we're going to move on with Stephen Cole. He's the Executive Director for the Plymouth Regional Economic Development Foundation. Welcome, Steve.
Thanks, Steve. Glad to be here. And I'm just going to dive right in because, as Mr. Samuel Clemens said, the secret to getting ahead is getting started. For those folks at home who don't know who Sam Clemens is, it's Mark Twain. It's true. It's another Twain quote today. I don't want to make folks aware of some of what was revealed yesterday. We're learning what we need to do now and when we need to do it. The Plymouth Economic Recovery Task Force is helping us get ahead by getting started. And we are getting started by helping businesses and public domains implement these guidelines. Businesses will have to think about how they do things differently. And I'll give an example. When you walk into a shoe store and you don't have socks on, I don't know what kind of reprehensible person would do that, but it happens. And we know it happens because there's a box of nylons that are there for you to use, right? Some of these retail stores in Plymouth, they're fairly intimate, they're cozy. And my sense is that we might need to start doing things as small businesses that are a little different than how we did things before. And for the foreseeable future, I'll defer to our health experts, but at least insofar as I can read in the regulations, for the foreseeable future, we are expected to cover our faces when we are not able to maintain at least 6 feet. And I understand some of that is a little bit relaxed when we're outdoors. But as I said, some of our retail shops are intimate and cozy, and they may need to consider doing things just a little bit different. We can get into a little bit of that later on in the broadcast, how we're intending to help. But I do want to make folks at home aware of at least 3 dates as we are entering into phase 1. Yesterday, of course, was the date at which manufacturing, construction, and worship was allowed to start regaining some of their normal operations, albeit with some restrictions and further guidelines. We're looking at May 25th as a date when offices can start to reopen, professional offices, but at 25% maximum occupancy. Barbershops, salons by appointment are also going to be open. Recreation and retail that offers remote fulfillment and curbside pickup. June 1st is a date I want a lot of folks also in our area to be mindful of, because that's the date at which Boston starts to reopen. I'm not going to go into greater detail because I do know our very own state rep is going to talk a little bit more about those guidelines. But I do want folks to be aware that if you have habitually commuted into Boston, then you may have to wait just a little bit longer than what we're seeing, at least for our own town and locality. The state did develop some guidelines to educate businesses on necessary supplies, and they created an online portal to connect businesses with manufacturers and distributors. Mass.gov is a valuable resource. I highly recommend folks at home, if you have some moments to kill and you really want to be up to date on what the state is saying, please visit mass.gov. At the very top of the banner, you're going to see update page for anything COVID. There are sector-specific protocols and best practices, including for barbershops and salons, car washes, pet grooming. These are mandatory safety standards and recommended best practices for phase 1. Phase 2 will include some opening of retail and restaurants and lodging with some restrictions and some capacity limitations. There will be more sector guidance for future phases at later dates. So please stay tuned to the broadcast to make sure that you're aware of those. I'm still looking for further information on what the task force was able to ascertain when they met on the 15th, but I do understand the state's recovery task force met with restaurant industry to discuss, with restaurant industry leaders to discuss opening. Bars, arts and entertainment venues, and fitness centers are part of phase 3. So as we learn more, we'll make sure our community is informed and prepared. But a lot of this is personal responsibility, folks. Progressing through the phases will only happen when the data shows that things are getting better. So this is not Candyland. This is more like Chutes and Ladders. We could look like we're winning, and then we end up taking the long slide down. So I don't want to exhaust analogies, but I do caution folks to please pay attention to the guidelines. I want to caution our businesses too. You may think you are ready to open because they gave you a date. I assure you, you may not yet be. So if you have any questions, comments, concerns, qualms, challenges that you're starting to see, please give the foundation a call. The foundation works closely with the Plymouth Area Chamber of Commerce. Amy Naples is my counterpart, who appears on Mondays, Wednesdays, and Fridays. Lee Filson is very active. Lee Hartman, who is the town planner. There's no shortage, folks, of people who are interested in making sure that our town is ahead by getting started early. Thanks, Steve.
That's Stephen Cole, and he's the Executive Director of Plymouth Regional Economic Development Foundation. He'll be here to answer your questions along with the other members of the panel. Send them to plymouthinfo@pactv.org. And we welcome back Plymouth Representative Matthew Muratore. Matt, you weren't able to be with us here yesterday, a big day of news at the state level, and I know you have quite a bit to review with us.
Yeah, I do, Steve. I hope, I assume you missed me yesterday, Steve. But yeah, I was busy trying to gather all this information that's coming in from the state yesterday. We knew this was going to be happening. I think the general consensus is there were more that was probably reopened than we thought would be, which is a good sign. As Dr. Potvin said, all the numbers, the indicators, the hospitalization, the testings, and even the deaths are dropping, which are all good signs. They need to drop, but I liked Stephen Cole's analogy. It's like chutes and ladders. I mean, we need to continue to have the numbers go down, but for some reason, if they go back up, we could go back to where we were last week. So we all need to kind of do the same things that we're doing, the wearing the mask when in public, 6 feet apart, et cetera. So, but again, the numbers are looking good. So I'm not gonna go through those today since Dr. Potvin actually did that. But what I want to do is actually share with you some of the reopening plan that occurred yesterday. And the first one is the reopening, the guidance for the industries. And it's pretty detailed. And again, as folks on the panel have said, it's mass.gov/reopening. You can actually look at all these. But as you can see under the businesses, the first ones that are allowed are already allowed are banks, dog walkers, financial services. But then when we get to phase one, which started yesterday, which is construction, firearm retailers and shooting ranges, home remodeling, in-home installation, manufacturing, worship, house of worship. But again, all these, the auto dealerships, car washes will all start in phase two, the drive-in movie theaters. Everyone was worried about hair salons and barbershops. Again, those open next week, so folks can be really happy. I understand the hair salons and the barbershops are overwhelmed with the amount of calls that are coming through to book appointments already. So be patient with them. But again, all of them have detailed guidance they need to have. They need to post. It needs to be readily available for the employees. So it's, as Stephen said, it's not as easy as opening up. You need to be sure you adhere to these guidance. You don't need to submit anything for opening. If you are one of these industries, you can open. You see the libraries are on here, but you just again have to stick to the guidance that are actually given. Pet grooming was another one. That was probably number two next to hair salons that we kept getting calls on. When are these going to open? When are these going to open? So they open on Monday as well. So phase two, it becomes a little bit more complicated. People are looking, well, when is phase two going to actually happen? Well, it depends. It depends on the chutes and ladders game, as Stephen called it. Whether if the numbers keep going down, as Dr. Potvin indicated, they are. It could be within the next 2 or 3 weeks that we could see this, and that's what we're hoping for. We've done a good job in the state of doing what we need to do to social distance and wear masks, but we actually need to continue to do this. It's not open season, so we still need to continue to do our job. But you can see retail stores can open for curbside. Casinos, if folks are interested, only the hotels and the restaurants will be opening. Driving school, a lot of kids that are interested in driving schools, those will be opening up in phase two. Again, we're thinking somewhere around June 8th. If everything goes well, this should be able to happen. Again, hotels and motels currently are open for essential workers only, but will open in phase two to serve folks who want to, start getting out, going on vacation, et cetera. Nail salons, and a lot of folks have been worried about nail salons as well. Those did not open in phase one, but will be phase two. Again, somewhere around the June 8th timeframe, given how the numbers work. Restaurants, a lot of confusion about restaurants, but it's very clear. Right now, restaurants, as we know, are still open to offer take-home deliveries. In phase two, they can begin opening dining areas. But again, there are going to be restrictions to this as well. These are still being looked at. Some clearer guidance will be coming out about restaurants in the next few days. So folks really understand what it is they can do. A lot of discussion about outdoor seating. Can there be outdoor seating? Like other states are doing, or New Hampshire or Rhode Island are doing that. I think there'll be some guidance that will come out about that to allow some outdoor seating for folks that can actually do that. You know, one thing I wanted to show on this one had to do with the amusement parks, and you can see that's in phase 3 or 4. Long way off. That tells you about crowds. And you start looking at bars and gyms and restaurants and movie theaters and museums. You know, phase 3 is still a ways off. Hopefully, you know, if everything again goes well, you know, that could be by the end of June that we could see phase 3 put into place. But again, there's more and more people, but we still going to have to practice social distancing until there's a vaccine found. So we are not out of the woods. We won't be out of the woods for quite some time until a vaccine is actually found. Again, concerts, theaters, larger venues like stadiums. There's still some discussion on professional sports. You know, when can they actually open up? There's not. There's nothing that the advisory board looked at for, you know, say the Bruins, the Celtics, or the Red Sox. They weren't really looking at this phase, but they are having discussions with these sports teams to see about how to do that. But all indications are, if they do open, they'll be opening without any crowds initially in place for some time. Recreation area, and this has been a big bone of contention for us around here, beaches. And you can see that, and I know Ken is happy about this, and Melissa's happy about this, that the beaches can open. I know it's supposed to be a nice weekend this weekend, but they really can't open until the 25th. Again, to allow for some guidance and postings to be put up. But again, parks will be under the same thing. Fishing and boating and hunting can open up on Monday as well. A lot of outdoor gardening and adventures, as you can see out here. Summer camps, a lot of discussion about summer camps. Those will be able to open up for day camps, which for me, that was a little bit of a surprise. I thought that would be put off until later. But I think when you look at the matrix and you look at the numbers, Steve, you'll see that there has been nobody under the age of 19 that has passed away from this virus, and nobody under the age of 19, or I shouldn't say, the numbers of under the age of 19 have been very, very small compared to the older population that have been getting the virus. So I think that's why, you know, summer camps and youth activities are going to start in phase 2, which again, phase 2 will be somewhere around June 8th. And then you can see some other outdoor activity, indoor activity, sightseeing, tours, historical sites, etc. So that's the locations. I also want to share with you, if I can find it here, the reopening itself. So this is the reopening that Dr. Potvin was talking about. Again, mass.gov/reopen. It's quite lengthy. I'm not going to go through the whole thing, but I do want to just get people familiar with it. So you can see where we've been starting on March 10th with the emergency that was declared by the governor to the reopening that was announced yesterday. Then you can see, you know, how we can get started. All the different organizations that were involved. Testimony from over 75 business associations, labor unions, nonprofits. There was written submissions of over 4,600 that were sent into the advisory board to help figure out how to reopen. And again, working together and how we reopen, what the employer's obligations are, what the individual's obligations are. You cover your face, you wash your hands, social distance. If you're sick, stay home. Anyone over 65, and Michelle and I were talking off air about this, you know, needs to still stay home because that's the population. 95% of those that pass away from this are over the age of 65, which is why you will not see the Center for Active Living open anytime soon until we can see better numbers on the deaths. You can see what government doing, what employers are doing. Set a business practice that adheres to mandatory workplace safety standards and protocols, and you need to post it as well. Reopening be driven by the public health data. We've been talking about this in the show, Steve, for some time now. It's all about the data. This is what Dr. Potvin was talking about. How the 3-day averages have gone down, which is why we've been able to reopen. Right? The hospitalizations, as I said, went down. The testing, the amount of positive tests have gone down. So we're really seeing some positive signs. But I love the analogy that Steve had. We can't be playing chutes and ladders here. We just got to continue with what we're doing. Testing and tracing will continue. The testing, we are looking to do up to 45,000 tests per day beginning in July. And by the end of the year, 75,000 tests. Right now, we're averaging somewhere around 8 to 10,000 tests per day. But that's going to be the key. The tracing is still continuing. They're doing a great job with contacting the folks who have contracted the coronavirus. They've got, I think, over 20,000 people they've contacted so far, and tracing where they were. There's going to be, if you go on the site, you're going to see the green light, red light, yellow, orange light on where we're at. More about social distancing, and these are the mandatory workplace safety standards for reopening. And also people have asked, well, what if I go to a place and not doing that? Who's going to, so I call the police? I mean, what do I do? No, ask for a manager and just make sure first. People are going to have to self-police this. They're going to have to, whether you are the customer or whether you are the employer, you all have to self-police yourself to be sure that we're following social distancing, hygiene protocols, staffing and operation, and cleaning and disinfecting. It just needs to happen so we don't continue the spread. Again, here are the reopening phases. We are in phase 1 right now, which is the start phase. Phase 2 will be more of a cautious phase, as I talked about, and somewhere around June 8th timeframe, give or take, depending on how the numbers look. Phase 3 is called the vigilant stage, and again, that would be maybe another 3 weeks after that. And phase 4 is, as you can see, once it's a vaccine or treatment in place, then we can talk about getting back to a new normal, and so that's going to be some time away. Again, you can't express this enough: the covering of the face, the washing the hands, the social distancing. Be vigilant with your symptoms and stay home if you're sick. And again, if you're over 65, stay home. It gives you some travel advisories on here of what you can do about travel. The gathering sizes, it's still less than 10. So you need to keep that in mind as well. I know there was a lot of discussion about graduation in Plymouth, and some folks saying, why can't we have a graduation? So, well, there's still, you can't have gatherings of more than 10 people at this point. Maybe in phase 2, but that won't be till probably right after graduation. There'll be more, but it's not going to be large crowds that will be allowed. Again, here are some of the openings that we've talked about in the phases. Beaches and parks, and drive-in theaters. Funny enough, I don't know where the nearest one is to us. I think there may be one down on the Cape, maybe, but those are becoming very, very popular now. And maybe for Stephen talks about, if you have business ideas, this is the time to start thinking. If drive-in movie theater may be something that people may want to think about trying to open up in this area. We don't have one close in this area, but I know as I look at all your ages, maybe everyone except Stephen may remember. I don't know about Ian either, but the drive-in theaters were very big. I know when I was growing up, so it'd be nice to see those come back and be more plentiful. So, but anyways, here. I just want to get people familiar with this. Again, it's mass.gov/reopening. It's really worthwhile to kind of go through it if you're going to be going back to work. If you're an employer, you want to make sure you're following what needs to happen. If you are a school or a college, they're still working on this. There's no announcements on schools opening for next year yet. The college and university, the state colleges and university, they're still working on those plans. Those probably will not come out till sometime towards the end of June of what's going to be happening. And again, it's all going to be based on what the matrix looks like, what all these numbers look like. And the only other thing I do want to share too is folks are still concerned about child daycare. So if folks are going to be going back to work, what are they actually, how's daycare going to work? Well, the emergency daycare centers are still open. There are over 10,000 open slots throughout the Commonwealth at this point. So there's plenty of capacity at this point. So if you're going back to work this week, look at the mass.gov site and look for child daycares. Find out what a child daycare is open in your area. And you just need to go. It's a drop-off center. You fill out a little bit of paperwork. and you have a slot there. You don't pay for it; it's paid for by the state. Same thing for next week. My guess is, though, as time goes on, the next couple of weeks, the child daycare centers may be starting to fill up a little bit. So the state is looking at, will they extend emergency daycare centers and open up more? They may do that before they open up daycares on June 29th. And even opening of daycares on June 29th, back up to what folks are used to, may not happen the way they're used to seeing it before. It may be limited to the amount of their occupancy license that they have. So it may be only 50% of what they can usually do. So we'll just have to wait and see. But at least this gives a pretty good overview, Steve, of what's happening at this point.
Thank you. And that's Plymouth Representative Matthew Muratore. He's here to answer your questions. Email us at plymouthinfo@pactv.org. Our purpose each day is to try to provide you with verified, accurate information as to how Plymouth is responding to COVID-19. Tomorrow we'll be joined by Dr. Mark Wilson. He's an epidemiologist. Also, Michael Jackman, he is from Congressman Bill Keating's office. Heather Cosby, she is a CPA from the town of Plymouth. Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. And now we're going to go to our questions. We're going to begin with Kenneth Tavares, Chair of the Plymouth Board of Selectmen. And Ken, Betsy, a viewer, asks if you can explain who in the town of Plymouth has been furloughed.
Certainly, I have that information here. I can give it to you by planning department. The furloughs were effective on May 11th, and there were 4 from planning and public health, 1 restaurant inspector from public health, 2 engineering surveyors, 13 librarians, 8 patrolmen that are in the academy, 4 building custodians, 1 parks foreman, 1 highway laborer, 1 transfer station attendant, and 1 DPW worker.
Thank you. And that's Kenneth Tavares. He is chair of the Plymouth Board of Selectmen. We're next going to go to Dr. Barry Potvin. Barry, James, a viewer, asks if there will be updated guidelines coming from the Board of Health regarding the opening of condominium pools, for example, such as the number of deck chairs and tables on a pool deck.
Well, I think the guidelines are going to be pretty obvious. You have to maintain social or physical distancing when you're at a pool also. So there may be limits on the number of chairs that are going to be made available. And they may not allow you to bring chairs of your own into those areas just to maintain enough distancing between the people at the pools. Whether or not that comes out of the Board of Health or the Select Board, I'm not sure, but I imagine there'll be also some state guidelines following shortly about that as well.
Dr. Barry Potvin is also the vice chair of the Plymouth Board of Health. We're going to go to Ann Dunn, Director of Assessing. Ann, viewer Arnie asks, what can he expect in terms of filing for an abatement of his real estate taxes? He writes that he has a business and that he has suffered substantial income loss this year at his business, and he's wondering whether or not, because of the nature of his real estate, which is designed to provide this business, whether or not an evaluation from an income approach can be used in order to request an abatement of real estate taxes for fiscal 2021.
So for fiscal 2021, the unfortunate part is we use everything from calendar 2019. And I do understand the situation that has occurred in our economic areas. So it is something that we're going to have to be looking towards and to see how it's affected the market. But currently, we'll be using 2019 to establish the values. And for commercial, we do look to the first 6 months of 2020. So we'll have to just see where the data comes in. And then again, when the values are released, they always have the right to file an abatement the month of January.
Thank you. Our next question is going to go to Plymouth Representative Matthew Muratore. Matt, Brianna, a viewer, writes that yesterday the governor set forth certain protocols, including cleaning with wipes in business workplaces after certain things are used. And she writes that these disinfecting wipes are not available locally. Does the state have any recommendation for business owners as to how to obtain these cleansing wipes that are going to be required next Monday?
I think it's disinfecting in general. I don't think they per se have to be exactly those wipes, but disinfecting in general is going to need to happen. I think if you just if you go on Amazon or something like that, you should be able to find some of these cleaning supplies, but or maybe go through the chamber, and the chamber may be able to help. But my understanding is that they're getting to be more plentiful of cleaning supplies that are out there at BJ's and the shopping areas, et cetera. But you may want to check with WB Mason or Amazon or something like that.
Next question also for Representative Matthew Muratore, and a question as to whether or not yoga studios fall under the fitness.
Yeah, they do, but they are looking at those. The advisory board is looking at that because there are some cases where yoga studios can be outdoors. So they are looking at the possibility of how that can fit into maybe the outdoors. So stay tuned for that one. But for right now, yes, it does fall under physical fitness, which is phase 3.
Thank you. And each day we go back to our panel to ask for a closing statement from each of them now that they've had an opportunity to hear each other speak. We're going to begin with Christopher Smalley. He's the Senior Director of Marketing and Communications at Beth Israel Deaconess. Chris, what would be a takeaway today from today's presentation?
Just 2 quick takeaways, Steve. One, again, thank you to all of the EMS, emergency medical system providers that are out there on the front lines. It's National EMS Week. And at the hospital, as Matt and others have said on this discussion today, it's going to take some time to reopen the Massachusetts economy. It's going to take time to reopen Plymouth. It's going to take time to reopen Beth Israel Deaconess Hospital in Plymouth. And once we are fully what we call recovery, back to recovery mode, there will be a lot of restrictions in place to protect the health and the safety of the patients, visitors, and employees. So we would just ask for patience when that does happen, and to go to our website, Beth Israel Deaconess Hospital Plymouth, for information that will be posted soon this week about the phases of our reopening. And there's also our hospital Facebook page as well. And again, we say this every single week. If you're having an emergency situation, please know that you can be comfortable in knowing that you can safely come to the emergency department for that type of treatment. Thank you.
Thank you. That's Christopher Smalley, and he is the Senior Director of Marketing and Communications, Beth Israel Deaconess. As we continue with our health component, we go back to Dr. Barry Potvin. Barry, lots of information has been coming our way in the past 24 hours. What do you want viewers to remember today?
Well, obviously there's a holiday weekend coming up, and I want to make sure that everybody knows it is possible to enjoy some of the things you used to do, maybe not in quite the same way as you did before. You still have to be observing the 10-person limit and keep physical distancing and use face coverings. Swimming is okay. Obviously, there's been reports the virus cannot survive in ocean water, given that the temperature is about 49 degrees in the ocean at the moment. I'm not sure very many of us could survive in that water for very long either. But if you're going to be a member of the Polar Bear Club, please enjoy and say hello to the ice cold water for me. Thanks, Steve.
Thank you. Also, we're going to go back to Ann Dunn, Director of Assessing. Ann, you've given us a lot of information that's found on the Plymouth website, very detailed. What do you want as a takeaway today for our viewers?
I want anybody age 65 or older or service-related veteran to know that they're still able to file exemptions through June 1st, and that should be mailed to the assessor's office and postmarked by June 1st. If anybody has any questions, you can call the office between Monday and Thursday between the hours of 8 and 3, and we'll be able to assist you. Thank you.
Thank you, and that's Ann Dunn. She's the Director of Assessing for the town of Plymouth. Michelle Bratti is with us each Tuesday. She is the Director of Elder Affairs. Michelle, also with you, lots of information. What can we tell our viewers?
Steve, I want to draw on something both that you said and discussion with Matt. The Center for Active Living is not going to be opening soon. It pains me to say that, but the reality is we will be one of the last entities in Plymouth to open, just by fact that we have to protect the most vulnerable population. As Matt had indicated, this virus is not serving the elder population well, and we are concerned, and the statistics, support that. So we want to make sure that you are safe. We owe that to you, and we owe it to our community. Know this, however, just because we may be one of the last to open, I can assure you that we are working as tirelessly along with the rest of the businesses in Plymouth to get a good plan in place, to look at every single aspect. I will tell you that the entire town, from the board to the town manager to all departments, are scrutinizing every single detail to make sure that this town is safe. And for the seniors, we're doing it 1,000 times that. So we have ideas, we're active, we're ready, we're getting ready for you to come back. But you have to use patience. And it's something Steve said, you have to be the most patient of all of the populations and all of the people in Plymouth. And that sometimes feels not good. It produces anxiety. It feels isolating. It feels sad. And I do want you to know, as Steve said, if you're feeling just very not in good space over this, if you're feeling isolated, if you're feeling a little hopeless over this, or for any reason, we are here for you. You can't physically come to our building, but I assure you we are here and we are ready to listen. And more importantly, we are ready to help. We will get you to the resources you need to feel better about this. Thank you, Steve.
Thank you. That's Michelle Bratti. She is the Director of Elder Affairs. We're going to go to Stephen Cole, who joins us each Tuesday and Thursday. Steve, what can we remember today?
Well, folks, I really want to drive home that point about personal responsibility. I grew up in this area, and I know that this is a community that takes care of its own, and it's adjacent communities. Let's face it, we have a very intimate working relationship with the folks in Barnstable County also. Matt, growing up on the Cape on the other side of the bridge, I went to Wellfleet Drive-In more than once. I remember seeing Casper when it first came out. So it is a unique experience to have grown up out there. So I guess at my age, it is a peculiarity. But personal responsibility is what it comes down to. And I think that just even noting that we have a little bit of a social conservative culture in our area. That's a tenet of that, right? Maybe you don't like to wear a mask. Make it fashionable. I'll show folks at home, this is what I choose to wear so that I can be compliant, but still defiant, right? It goes great with the gray suit and blue eyes. But what's more, I'd say that, this is all incumbent on us to be prepared and ready to not only welcome our businesses to start again or to reopen, but we are a tourism destination. We really do need to put forward a good leading example for not just other communities in the Commonwealth, but also for those guests that we intend to invite back here. Maybe you don't want to wear a mask because you grew a sterling quarantine beard. And so what I'd like to tell folks watching today, it's a little bit of a soft launch, but the foundation, along with the Chamber of Commerce, Destination Plymouth, and the Economic Recovery Task Force, we're putting together ideas for fundraiser events to assist small businesses cover the costs and adapt to new regulations and requirements in the aftermath of COVID. And what's more, we're going to need signage. We're going to have to do things to inform our guests and visitors to what is proper behavior so that they are safe. Right now, the worst case scenario is that, maybe the crowds that we were expecting didn't come to Plymouth 400, right? The worst case scenario right now is that when people come, over 1,000 cases are somehow linked to Plymouth because people weren't doing the right thing. That's a much harder thing to recover from. So getting back to my point, maybe you have a great beard, maybe you have some really crazy quarantine hair. I want to announce that we're launching a fundraising event Plymouth County residents are invited to submit a photo or photos of their hair and or beard that they grew during the COVID-19 lockdown. There will be a nominal entry fee that will be assessed, and the collected fees will be used to assist small businesses adapt to the new regulations and prepare our public spaces with signage. The focus of each photo should be your hair or your beard grown during the lockdown. There will be a panel of judges to review photos to determine winning entrants under several categories, and prizes will be awarded to winning submissions. In order to be eligible, you just have to be 21 plus, live in Plymouth County. Submissions must be of oneself, no third party or doctored photos of our state rep with a big bustling beard and an afro. So it must be of oneself. Photos must be taken during the COVID-19 lockdown. So anytime after March 13th, let's say, but before June 30th. As our state rep mentioned, we'll have to be patient because as salons and barbershops open, we'll have to have appointments only. So I think there's some time right now for folks, even though barbershops open on the 25th, I think there might be some time for you in the next week to do something crazy with your face. That'll do it for now, Steve. We're going to announce the winners on July 3rd so that when we're convening with friends and family safely on the 4th, the winners will have some bragging rights.
Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. We're going to go to Plymouth State Representative Matthew Muratore. Matt, what do you want to close with today?
I don't know. Stephen's always hard to follow. Boy, oh boy. What I want to do is just, Julie, you bring up the submitting of questions for me. So there is this on the mass.gov/reopening website. If you're a business and you have questions or you need some guidance on what phase you go, it's a very simple form that's on there that you can scroll through and send in your information. Or if you're an employee going in, or if you're a customer that's going in, it's a very useful tool. And I can tell you they scrutinize every single one of them. They get back to you on every single question you have or whatever guidance you're looking for. So that's a very helpful tool to look at, number one. Number two, with regard to what Chris was talking about with the hospitals and the community health centers will open in this phase starting next week as well for preventive care and treatments of high risk patients and conditions. So we can start. That's another good sign that we're starting to see the hospitals and the clinics starting to open again. So that's a really good sign. If you have therapy needs or things like that, those things are going to start resuming. If they're just regular routine, dentist cleaning and things like that, those are going to be held off. But other things that are more preventive for care and conditions, those are going to be open. So keep those in mind as well. And we'll have more as the days go on, more information to provide. I do also want to wish the EMS folks out there, particularly Brewster Ambulance in the town of Plymouth, for a happy National EMS Week. We were remiss to announce that last week was National Nursing Home Week, so we thank all those that work in our healthcare and our nursing homes and what they're doing. And they've tested on almost every single nursing home in the Commonwealth. Assisted living and rest home has been tested now, so they've all been doing a terrific job of testing all our seniors, who as we know are affected by this more than anybody. Over the age of 65, 95% of deaths have occurred. And 61% have occurred in these long-term care facilities. So we know we have a ways to go. We have to protect our seniors. I applaud Michelle and her staff, what she's doing for the seniors. It will be some time before you open, but you're doing a terrific job keeping in contact with them, providing whatever services that are needed for them, because that's the population that we need to really watch over and protect and help any way we can. So I applaud you for what you're doing and continue to do that. Also, I do want to. I'm going to steal that phrase that Stephen Cole used. I'm going to use this a lot, I think. And this is a game of shoots and ladders, folks. It really is. And we still have to be careful. We have Memorial Day weekend coming up. We have some good weather coming up. It's great to go out. You need to go out and to the beach on Monday or the parks, but you still need to social distance, physical distancing, and wear a mask. Again, you're going to save lives by doing that. If you're over 65, unfortunately, we're going to ask you to still stay in the house unless you have to go to the grocery store or go to the pharmacy or something. But So we're still in this. We want to make sure that we're not playing a game of chutes and ladders, but that we continue to see the numbers go down, as Dr. Potvin indicated, so that we can really get back to a new normal sooner than later. As always, make sure you stay informed by going to mass.gov/COVID-19 for the most up-to-date information, including about the reopening. Call 211 if you have questions on anything related to the COVID-19. Get text alerts by texting COVID-MA to 888-777, or in Spanish, COVID-MA ESP to 888-777. Or if you have questions on your health, go to buoy.com/@mass. Stay calm, be safe out there, wear your mask, physical distance. Thanks to all those folks that are out there, those essential workers that are taking care of our physical health, and those that are out there taking care of our economic health. And again, the more we keep coming together by staying apart and listening to these rules and regulations, the faster we'll get back to the folks we love and the things we love to do. So thanks again, Steve, for another good show. And thanks to PAC TV.
Plymouth State Representative Matthew Muratore. We're going to go to the chair of the Board of Selectmen, Kenneth Tavares. And we want to thank all of our guests, Christopher Smalley, Dr. Barry Potvin, Ian Dunn, Michelle Bratti, Stephen Cole, Matt Muratore. Ken, closing thoughts.
I have a few, Steve, that I'd like to pass on. And the first is to the Muratores and the Brattis. Congratulations. We found out that there are two couples observing their anniversaries today. We wish it was under easier conditions where you could be out in a restaurant sitting down, but we know that's going to come along soon, hopefully. But in the meantime, the men in the family remember to do takeout tonight. To be expected. I'd also like to thank Town Clerk Pizer and his staff, all the poll workers, and the Secretary of State for coming together to make sure that this election got off the way it should, as if we weren't in a virus environment. There were a number of roadblocks that were put up, but Larry and his crew have done a very successful job of overcoming them. And I also want to thank my colleagues on the Board of Selectmen, Selectman Mahoney and Selectman Flaherty, for volunteering to work the polls today. So if you see two people that look like them, that is them. They are out working the polls. Also, I want to talk a little bit about where we need to go this weekend. This past weekend, we had a show of loss of patience. I know people are getting tired. They want this to end. But it's really now up to us. The governor has laid out a very strong plan to open with the 4 steps. But we are the ones that are in control of this. If we start to relax our guard, lose our own patience, we're going to go backwards. And I don't think that's a place that any of us want to start over again. So again, and you'll hear it from us until you don't want to hear it anymore, which is probably right now. And that is, to wash your hands, wear a mask, keep the distance. By doing this, we're not passing this virus on, and we are seeing it start to slow down a bit. So with that, Steve, I pass it back to you. Thank you.
Thank you. That's Kenneth Tavares. He is the chair of the Plymouth Board of Selectmen. We'll be back here tomorrow and Thursday. Tomorrow we welcome Dr. Mark Wilson, an epidemiologist, Michael Jackman from Congressman Bill Keating's office, Heather Cosby, Plymouth CPA, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce, and they'll be joining Matt, Ken, and me. And at this time, I'd like to thank you for joining us today. My name is Steve Triffletti, Plymouth Town Moderator. Good day.